Okay, I think we'll begin now. So good afternoon, everyone, and welcome to today's postgraduate information session on our Master of Public Health. Thank you for taking the time to join us today. My name is David McKinnon. I'm part of the student recruitment team here at GCU, and I'll be your host for this 30-minute session. Before we begin, just a couple of quick housekeeping points. All the microphones and cameras are disabled during the session to ensure a smooth experience for everyone. And if you have any questions at any point, please pop them into the chat box, which is on the screen. You'll see to the right of the Martin and myself on screen there. We'll be answering as many as we can during the Q&A session at the end. So Martin will present first, and then he'll answer the questions, and I'll answer any non-program specific questions. I'd also like to let you know that today's session is being recorded. It will be available on the GCU YouTube page in the coming weeks, so you'll be able to watch it back or share it with others. Now, I'm pleased to introduce you to today's presenter, Martin Murchie, who will be speaking about our Master in Public Health. So handing over to you now, Martin.
Thanks. Thank you for that. So welcome everyone to, my name is Martin Murchie, as David has said, and I am the programme lead for the Master of Public Health programme here at Glasgow Caledonian University on our Glasgow campus. You can see on the screen my email address if you have any questions after the session and you'd like to email me to clarify any points if they're not clarified during the session this afternoon. Our philosophy for the Masters of Public Health is to prepare and develop public health practitioners from a variety of different backgrounds in order to prevent disease, promote health and protect the well-being of the population. And we do that in the programme through education, research, and bringing in external practitioners from public health practice and service to give you a whole rounded public health experience and develop your skills, not only for the UK, but globally in terms of public health practitioners. For the team within the programme, the practitioners will prevent disease, as I've mentioned, promote health and protect well-being through the three key areas also mentioned earlier through education, research and public health practice. These key areas are three key domains of the public health practice as defined by the UK Faculty of Public Health. So they come under the umbrella of health protection, health improvement and health services, all key areas for public health practice within the UK. On the screen now, you can see some feedback from our previous students, our alumni who have finished the programme and went on into careers within public health. You can see in terms of some of the comments we've had back in terms of the teaching, the support they received from the team, the diversity within the classroom and within the lecturers within the programme team in terms of to have a fully rounded public health experience. If you are starting in September as one of our September students, which I hope you will be in trimester A, you will take 3 modules within trimester A. They will be advanced research methods, principles and theories of public health practice, and epidemiology, principles and application evaluation in practice. These will be your first 3 modules you'll undertake, and at the end of that trimester, with successfully passing the assessments, then you will have received 60 academic credits. In trimester A and trimester B, you will always be studying 60 academic credits. Moving into trimester B, you undertake 4 modules within this trimester, all at 15 credits each. So that would be social action approaches to public health, applied statistics and data analysis for public health, evidence-based public health, and then an optional module from the 3 you can see within the red square currently on the screen. They were either you can have an optional module of infection prevention and control in a global context, health economics, or navigating the policy content. All of the 3 optional modules are key and important for public health, but they'll let you delve slightly more deeper into an area that you may be more interested in. On completion of trimester A and trimester B, you should have 120 credits, which will allow you to progress to your dissertation and the award of your Masters of Public Health. Your dissertation is a piece of empirical research or a structured literature review that you undertake in relation to a public health topic of your choice, and you're supported with a supervisor throughout trimester C in terms of to support you towards the achievement of your dissertation and your MPH award. The optional modules I mentioned earlier are here on the screen, and they are sent out to you in terms of to look for first, second choices in order to ensure that everyone has enough chance to get into one of their chosen modules there. But these would be in trimester B and would be the 3 optional modules on offer to you. To give you an idea of the assessment overview, there is a variety of assessment strategies and throughout the programme. So throughout trimester A, B and C, we have coursework written assignments, we have research protocols in some, there are some developments of posters and abstracts, some presentation work, there are some open book exams within that also, all to allow you to develop different skills that you would require as a public health practitioner. So that may be having to do a public health presentation when you qualify, or it may be developing a policy for public health. So we're trying to align our assessment strategy not only to assess your knowledge and skills within the module, but also to help you develop further for your skills for when you successfully complete the Master of Public Health programme. The award that you may be aiming for is the Master of Public Health, the MPH, which is 180 academic credits. However, there are 2 other exit points within the programme, whether you want to exit early or whether you do not achieve enough academic credits to meet the Master of Public Health award. So they are, with 60 credits, you can leave with a postgraduate certificate in public health. With 120 credits, you can leave with a postgraduate diploma in public health. However, I know that most of you will be more interested in aiming for the Masters of Public Health, which at the end of the 3 trimesters would be 180 credits. We have a diverse team within Glasgow and London providing this programme. We have practitioners from a part of the team. We have senior academic staff, we have researchers, we have senior NHS staff and senior people from local government who have all come to join the MPH team to deliver this diverse learning experience to our students. You can see here on the screen the details for myself and my deputy programme lead, Shadrach, with on the screen, and our programme coordinator, Nikki. I've also included London's contact details here as well, for those who may be interested in undertaking the programme in London. Along with the MPH team, from which you will receive a personal tutor for your time within the programme. So someone who can help support you academically, who can help you look at other support needs you may have, and someone you can go to for any questions you have. So you will always be allocated a personal tutor within the first 2 to 3 weeks of joining the programme, in terms of to make sure you have that academic support throughout. Along with that, GCU offers a range of other support services that we strongly support our students and advise our students to use. So we have the Learning and Development Centre, who can provide you with advice around academic writing at level 11 and can support you with your writing skills and developing them throughout your time within the programme. We have our library staff and a fantastic library on campus, the Sir Alex Ferguson Library. And in terms of our library staff are there to help support you with seeking and searching the appropriate academic literature and research you would require to help develop your knowledge and skills and also achieve your assessments. We have the Student Wellbeing Service within our Glasgow campus. We have a visa team. We have a career service who will help you look at employability on completion of the programme. And we also have the Students' Association with an internet cafe that you can access. All fantastic extra support services for your time here at GCU on our Glasgow campus. I feel as we've rushed through most of these so in terms of some of our points, but we can go back to them if there's any questions, particularly about some of the areas. You can obviously also visit our Masters of Public Health site on our GCU website. It's very easy to find for further information and to clarify some of the points I have mentioned. On that site, you will see that you can study the programme as a full-time student, as a part-time student, and also as a distance learning student. So there are a variety of different options for studying the programme. If you start in September, trimester A, you would be a full-time, you could choose to be a full-time student, which would take you through 12 months of study to the completion of the programme.
Thank you very much, Martin, for that great presentation. We'll now move on to the question and answer part of the session. So if anybody has any questions they want to post, can you put them in the chat on the right-hand side, and myself and Martin will do our best to answer them for you. We'll try and get through as many questions as we can before 1:30 UK time. If we don't manage to get through your question today, if you think of something afterwards, please don't hesitate to get in touch via email. You'll send us Martin himself with the MPH mailbox, or as a more general question or inquiry about your application, or just anything about the course in general, contact studentinquiries@gcu.ac.uk. So please don't be shy, post away. Can't believe with so many people attending, no one's got any big questions for us. Did Martin
It's all very quiet. Yeah.
Okay. We'll give it a few more seconds to see if anybody's still typing away with a big long question or anything like that.
Yep.
No, if it doesn't look like we're going to get any questions here, I think you must have wowed them with your presentation, Martin, and answered all the obvious questions people have. But as I say earlier, if anybody's got any questions they want to ask, we've got the email addresses for Martin and the MPH team there on the screen. And it's about your admission side of things and student inquiries at gcu.ac.uk. And I see we have a question now.
Yeah, Zainab. So Zainab's asking how to reach the support centre, please. Zainab, I'm a bit unsure about what you mean by the support centre. Do you mean to do with your admission, your application?
Certainly anything related to the programme. Zainab, Martin's got those two email addresses on the screen for himself and his MPH team. But if it's about the admission side of things, then we contact student inquiries at gcu.ac.uk, and they'll be able to help you with applications.
So I think that was what Zainab was after, David, it looks like there. So I can see we have another question there saying good afternoon. What's the duration for the January batch entry? So if you're a January student, you would study the programme. I'll maybe flip back just quickly to the slide. So you'd be commencing in trimester B. Then you would have actually trimester C off, and then recommence the programme back into trimester A, and then do your dissertation in the following B. So it would be 18 months in total would be your study time, rather than 12 months in September. Yeah, so it'd be 60. It's the same question for yourself, for posing me. It's the same thing. It's roughly 16 to 18 months.
As he's at, certainly in the general side of forums, we have a private Facebook group for postgraduate offer holders. We also use something called Unibuddy Communities, where all our offer holders for the postgrad for each the September intake and the January intake can join and meet students from your course, or just any students joining in the coming intake. But I don't know, Martin, maybe when there's any public health specific groups?
Yeah, David. So there's obviously anyone who commences a programme, there would be an induction and an opportunity for you to meet your fellow new students. And you'd be joining classes, actually, the students who may have joined in the previous trimester once the module classes commence. So you get to know your students, the larger cohort, very well. There's also international events if you're an international student, put on by our international leads. In terms of welcoming and also in terms of just getting to know the campus. And again, other students from other programmes across the university who may have came from international backgrounds. So, Module Piola, I can see you're asking how many months breaks does the January intake have? So you can see the vacation breaks if you go to look at GCU academic calendar. If you Google that, you will see it for 26-27. However, you would most likely, if you commence in trimester B in January, then the teaching would probably stop maybe around about now. And then it's the assessment period up until a couple of weeks into May. And then you would have a break probably from a vacation period, probably from mid-May to roughly probably nearer the end of August. But there are some other weeks, and thank you, David. There are some other weeks around in between the other trimesters, which are vacation periods too. But as I said, January cohort tend to have all of trimester C free because of the January start, the commencing of Tri B.
Anyone else got any more questions for us?
You're welcome.
Okay. If no one's got any more questions for us, then I guess that brings us to an end of today's session. I'd really like to thank Martin once again for his time and his expertise, and also extend a big thank you to you all for attending and for your engagement. Oh, we've got another question popping up. When are we getting CAS for September intake? At the moment, the CAS team are doing what we call pre-CAS interviews. And I know they're aiming to start issuing CAS data checks and CAS next month. I'm not sure whether it's the end of the month or towards the end of next month, but certainly they're aiming to start getting CAS out at some point next month. Any more questions before we wrap up? It's always a waiting game, isn't it?
I know, that's the typing, isn't it?
I know if I'm typing, I'm quite slow at typing, so it's like, it's 30 seconds to finish typing my question. Right. I think we could be out of questions now. You're still typing, get it in quick, but thanks again to Martin for his presentation. Also, a big thank you to you all for attending today and your engaging questions as well. Just a reminder that this session has been recorded and will be available on the GCU YouTube channel in the coming weeks, so if you'd like to revisit any of the content. And we hope you found today's session helpful, and we look forward to hopefully welcoming many of you back to GCU as postgraduate students on the MPH course. Thank you all and have a great day.
Thanks, David. Thanks, everyone. Bye.